Thousands of Meta employees could soon be in the market for a new job. After sweeping cuts at Twitter, Meta, formerly known as Facebook, is expected to lay off thousands of employees starting later this week.
I'm sure you've heard by now that there have been tens of thousands, if not hundreds of thousands of mass layoffs in the tech industry over the last 2 years. But what this video is about is the comparison between software engineers and nurses. We're comparing the two because nurses are leaving the profession in droves. Many of them are just choosing to leave the bedside and moving to an area away from it. Some of these nurses are becoming school nurses, nurse educators, flight nurses, or they're leaving for a career that has nothing to do with nursing whatsoever. A survey of 2,500 nurses released this year found that 64% of nurses are looking to leave the profession, a nearly 40% increase from a similar survey just over a year ago. 3/4 of the nurses surveyed said they experienced burnout since the pandemic began, and half said they experienced feelings of trauma, extreme stress, or even PTSD. So, where are these nurses going after they quit the profession? Aside from the areas previously mentioned, one area where nurses are beginning to flock to at a much higher rate than ever before is software engineering. So in this video, we are going to be comparing the two. First, let's talk about what it takes to do any one of these jobs. Software engineers need to learn computer programming languages like JavaScript, Python, HTML, CSS, SQL, and various other programs. These programs allow them to create, manage, and troubleshoot the code that runs software programs we all use on a daily basis. Oftentimes, software engineers will work with others in a team and perform research to solve problems that do not yet have solutions. As a software engineer, you can work in a variety of settings though, but the companies you're always hearing about are the FANG companies. These are companies like Facebook, Amazon, Apple, Netflix, and Google. These companies are considered the Big Five because they're 5 of the most dominant tech companies in the United States. As a software engineer, you also have the benefit of being able to work yourself up the ladder in a company or create your own startup from the knowledge you gained as a software engineer. Now, what about nurses? Well, nurses, on the other hand, provide direct and indirect patient care, such as administering medications, drawing blood, coordinating care with other members in the healthcare team, and managing cardiac monitors to carry out a treatment or disease prevention, just to name a few. Nurses have also been known to work their way up from bedside nursing to chief nursing officers in major hospital systems. And with the help of an advanced degree, they even have the option to start their own practices. So similar to software engineers, nurses have virtually an endless amount of options for places they can choose to work in. Nurses can work in hospital settings, assisted living facilities, clinics, outpatient surgery centers, dialysis clinics, infusion centers, schools, corrections facilities, or even at a Tesla factory. Now let's talk about education. To become a software engineer, you have so many options. You can either teach yourself how to code, attend a coding bootcamp, or get a degree in computer science. If you teach yourself to code, this is the cheapest option, but it's not as linear or organized as attending a bootcamp or going to school. Attending a bootcamp, on the other hand, is going to be your second cheapest option, and it's going to often take anywhere from 3 to 6 months to complete. And a computer science degree is often the most expensive and the option that will take the longest for you to gain employment as a software engineer. But what about the education requirements for nurses? Nursing is a very traditional career. There is no way to teach yourself how to be a nurse, and you can't gain employment unless you have a state-approved nursing license and a college degree. To become a nurse, you will need at least 2 years of education, but you can go all the way up to several other advanced degrees, including becoming a CRNA or getting a doctorate in nursing. These advanced degrees typically take 6, 8, or even more than 8 years to attain. Once you have your nursing license though, you can be trained on the job for many different specialties. And now let's talk about the demographics of tech versus nursing. If you are a software engineer, you are going to be working in a male-dominated field. 80.8% of software engineers are males, while nursing is the exact opposite, as it's dominated by females, with 88.2% of registered nurses being being females. Now let's get to the nitty-gritty of it, of why nurses are actually leaving the profession to software engineering in particular. The median salary for software engineers in the US is $120,730, and they typically work a regular 9-to-5 job. If you go to Levels FYI, which is a website that provides transparent salaries for employees in the tech world, an entry-level software engineer can earn up to a total compensation, which is their base salary, plus any restricted stock units, of $266,000 per year at a company like Airbnb. But the potential to earn an upper six-figure salary as a software engineer is much more likely and requires a lot less work than trying to do the same as a nurse. The median salary for nurses in the United States is $76,600, and they often work 3 12-hour shifts per week, and they also have to work every other weekend, while software engineers usually get their weekends off. Another thing to note is that nurses don't earn restricted stock units or RSUs, and they also don't qualify for the bonuses that tech employees often qualify for. However, the highest paid entry-level nurse can earn up to $196,557 in their first year as a nurse, working 40 hours per week at Stanford Hospital in California. But here's the downside. Oftentimes, nurses do not earn sign-on bonuses, relocation bonuses, peer bonuses, which are bonuses given to tech employees that volunteer to help another team member out. It is also very unlikely that you are going to meet a nurse that is going to receive an annual bonus, which is an incentive that software engineers usually get and can range anywhere from 10 to 20 or even 30%. And another incentive that software engineers get is an initial equity grant or an equity refresh. Now let's talk about the job outlook for both of these careers. Like I mentioned at the beginning of the video, software engineers have been getting laid off in mass numbers. Layoffs are much more common in the tech world than they are in the nursing world. And the reason for this is that nurses cannot be outsourced. I remember before I became a nurse, I was not a software engineer, but I worked in the finance sector, and I, like many of my other coworkers, were easily replaceable. During the recession in 2008, I remember being called into one of our supervisor's office to be told that I was one of 50 employees that was going to be laid off that day. And on that particular day, I made the decision that I would then become a nurse, because nurses have security and stability. There's always a need for nurses, and nurses have multiple career paths and options. In this job, you're able to improve the well-being of people and save their lives unlike any other profession I've ever heard of. You also get flexible work arrangements. For example, I only work 20 hours a week, and I work 5 days in a row, but I get 9 days off every other week. You can choose to work day shift, evening shift, night shift, swing shift. These are just some of the few options that nurses can choose from. But the beauty of being a software engineer is that if you are a software engineer, you don't have to work in an office setting. You can work from home. You could be in another city, you could be in another state, or you can be in another country doing your job and getting paid to do it. You also have the option to pick up side gigs as a software engineer. And like I mentioned before, if you form your own startup, you will be the founder and the owner of your own company, and you can manage your schedule any way you see fit. Now let's talk about job satisfaction. If you're a software engineer, according to a survey that was reported by PayScale, software engineers have a job satisfaction rate of 4 out of 5 stars, and based on the report, software engineers are generally satisfied with their working conditions and their benefits. Their satisfaction stems from the availability of high salary compensations and health benefits to cover critical areas such as vision, medical, and dental benefits. According to the survey report by PayScale, registered nurses have a job satisfaction rate of 3.7 out of 5 stars, and based on this report, registered nurses are most satisfied with their dental and medical benefits, but not so much with their salary compensation. Another survey of nurses also showed that only 40% of nurses reported being very satisfied with being an RN, compared compared to 62% in 2018. And 2/3 of nurses said that they intend to leave their current position in the next 3 years, compared with 54% in 2018, and 36% of those plan to leave in the next year. Being a software engineer has many perks, and it makes sense why so many nurses are considering it as an alternative career option. However, if part of your reason for wanting to leave the profession is because you feel like you are being underpaid as a nurse, then watch this video here to see where the highest paying California hospitals are located.